My name is Alex Binder. I'm the Vice President of the Parker Advanced Care Institute at the VNA Health Group. My role there is essentially to manage two medical practices. One is a visiting physician practice, and the other is a palliative medicine program. And I'm here today to talk a little bit about the benefits and the background of house call medicine. People ask, do doctors still make house calls? And yeah, I think we can all think back of the day when physicians used to come out and make house calls on a regular basis, primarily for pediatric, for small patients. And then that sort of evaporated a little bit due to logistics and economics and so on. But now we're seeing this resurgence in house call medicine, primarily due to the fact of the aging population. So there's a new population that could really benefit from house call medicine, and we're working towards getting more house call docs to go out and help the aging population. So many people ask, what are the benefits of having a house call or a house call doc? There are many benefits. I think the number one benefit is to think of a patient who has trouble getting out of the home, and it's a challenge for the family, and therefore we provide peace of mind. We lower the stress level. It's very comfortable to have a visit within your own home. You're not distracted. It's not an unusual surrounding. There's not travel involved. It's safer. You're not going into public spaces where there could be some other viruses that are out there and so on. So for that perspective, it's a much better alternative. But really, from a medical perspective, for this specific population, it's much better because it provides a comprehensive assessment. What we find is that we can understand if there's safety issues in the home. Are there loose carpets? What is the diet regimen for this patient? Additionally, a lot of times patients say, I'm on these 7 medications, and we could look at the bottle and see that maybe they haven't been taking some of those medications. So again, it's a much more comprehensive process. And the communication is improved, we think. We can spend the time to sit there. You can have a family member present. You can have 2 family members and the dog present, and we'll be able to go ahead and share with you in a much more comfortable surrounding and setting what's going on with the patient, what is our assessment and our treatment plan. So who should have a visiting physician? And we like to say that if you already have a primary care provider that you can get out to see, that you should stay with that. There's value in that relationship. There's a lot of history and knowledge that PCP has. But typically at some time in a person's life, they have more challenges in terms of mobility, getting out of the house. They're just not as healthy and mobile as they used to be. And other signs are maybe you have multiple chronic conditions and you can't get out to see all these specialists anymore. So that could be an indicator. You're on many medications. Sometimes patients are on 15 or 20 medications. Sometimes that can be consolidated, and you need a comprehensive primary care provider who's going to assess all of that and be able to de-prescribe in some cases to make sure that the patient is safe and comfortable. And another sign is if you find you're going to the hospital somewhat frequently or more frequently than you would prefer, can a visiting physician come to the home, help stabilize the condition, and keep that patient comfortable and safe at home. So those are some of the signs that somebody could benefit from a primary care house call doc. And we always like to say we don't come out and just provide a house call for convenience. We really want to be that primary care provider for that next stage of life. That's where it makes the most sense. So where can you find a visiting physician? You probably have to Google it and ask some people, maybe ask your neighbors, but there aren't too many visiting physicians around anymore, and one of the reasons is because of the economics. You can understand that it's not a terribly productive environment for a physician or a nurse practitioner to be driving around all day. They only make They may only see 5 or 6 patients in a day, whereas in an office you'll see 40 patients. So you'll have to look. There aren't that many, but again, word of mouth, some of your senior resources in the community, as well as the good old internet. So if you find a couple of potential visiting physician practices, some things you should ask. Number one is this the focus of your program? Or do you just make house calls on Wednesday afternoons? We find that you have to build a model around the house call delivery. So that includes receptionists may be different in a house call practice versus an office-based practice. The on-call setup, coordinating different types of services is handled differently. So you want to find a house call practice that's pretty much focused on house calls and not doing it as an adjunct to their office-based program. So the most common question that's asked about house call medicine is, who pays for this? And this is covered by Medicare. It's a Medicare benefit, but there are also Medicare Advantage programs out there. So you need to check with the provider. You need to see what type of insurance you have and see if they accept Medicare, see if they accept the Medicare Advantage program you have. And then typically if you have Medicare as your primary, you're going to have a secondary insurance. And again, for the majority of cases, practices will accept any type of secondary insurance if Medicare is the primary. So what can be done in the home? Pretty much we like to think of this as, this is very similar to going to your primary care provider in the office, but instead the primary care provider is coming to your home. So we provide that primary care. We're going to do this complete assessment. As I mentioned, it's more comprehensive. We may ask to see your medications, but we also can coordinate different activities. Some patients have a visiting nurse coming out. Some patients have a physical therapist that they may need physical therapy in the home. We will coordinate that. Sometimes patients will need a wheelchair or a walker or even a hospital bed. Again, house call programs can help coordinate a lot of those activities, as well as finding community resources, whether through SCAN or somewhere else. We find that there's opportunities. There's Meals on Wheels programs. There's other learning programs. So we can put patients in touch with some of these community resources. And lastly, we're familiar, although there aren't many, there are some other visiting specialists, such as a podiatrist or a visiting dentist. So we're familiar with other providers, clinicians that work in our space that do something similar to us, and we could help make contact and make referrals to those organizations. Something that comes up from time to time, and I thought I would cover, is this topic of palliative medicine. And it's being discussed more. We see it in, in the news. We see it announced by some healthcare systems. But what is palliative medicine? Palliative medicine, the definition is some type of specialty care that's given to patients who have life-limiting conditions. Typically patients who have some type of chronic disease that's not going to go away, that's going to continue to progress, and you have a palliative physician take a look at that patient. So what does the palliative physician do? Well, they can organize all the medical records, look at the history of the patient, find out where they are on this trajectory of this disease, communicate these things with the patient and the family. And one of the most important things is that they will ask and talk to the patient and family. What are your wishes? What are your desires? If you know X, then what would you want Y to be? And to get on the same page. Too much of medicine nowadays is more or less I'm not going to say cookie cutter, but it's a very evidence-based progressive process. And what we try to do, what a palliative physician tries to do, is understand what's important to this patient and their family, and then to create a care plan, a treatment plan that's in alignment with their wishes. So the challenge is there aren't that many palliative docs out there. And I bring up this whole topic because what I think needs to occur more often is that primary care providers need to integrate and incorporate this palliative philosophy into their practice. Are they explaining the trajectory of the disease? Are they listening to the patient and the family? Are they setting these treatment plans in conjunction and alignment with what those patients' wishes are? So it's very difficult to find a palliative physician, but when you look for a house call doc, you can ask, do they integrate some type of geriatric and palliative approach with their primary care? Because typically that is the patient population, and that, what we find, makes the most sense to take care of these patients that are at home with their families. One last point is our patients, hopefully they have a good experience with us or with their house call doc. Their condition typically is going to progress, and then we will transition patients to hospice when appropriate. I just want to make a mention of hospice. Hospice is really a benefit to the patients. I know there's a lot of stigma associated with hospice. All patients who go on hospice die, those types of things. Is this causation or correlation? Well, hospice needs to be thought about as just another set of resources to help this patient and this family as they transition into this last stage of life. And it helps them understand what's going on. It helps them care for that patient. And it also helps treat the family to prepare for the end-of-life situation. And again, to find a primary care physician who will understand that, help patients transition to hospice when appropriate, and also the primary care physicians can stay involved in the case. They don't go away when the patient goes on hospice, so nothing necessarily changes other than we're able to bring in another set of resources. That concludes my presentation, and I just want to thank everybody.